Hello, everyone, and thank you for joining us today. Our presentation focuses on bipolar disorder, specifically in the case study of George Lawler. This project allowed us to apply our understanding of diagnostic criteria to analyze his condition as well as come up with some treatment options. We hope to provide you a comprehensive view of this complex disorder. Let's begin with George Lawler's background. He is a 35-year-old athletic coach and father who has a history of depression as well as a family history of bipolar disorder. His first depressive episode occurred during college, which led him to treatment, and they treated him with antidepressants as well as psychotherapy. Over time, his symptoms appeared to stabilize, but eventually stress triggered a series of hypomanic and depressive episodes. These patterns led to behaviors that became more concerning, ultimately requiring hospitalization. During George's hospital admission, he exhibited some dangerous behaviors, including bringing a sword to a university game, as well as displaying erratic behaviors with a news reporter. Due to his lack of insight into his condition, he was involuntarily admitted for treatment. One major concern was his inconsistent use of the prescription of lithium bicarbonate, which significantly impacted his stability. It's crucial when trying to understand George's condition that we differentiate between bipolar disorder and major depressive disorder. Bipolar depression is distinguished by a history of manic or hypomanic episodes, whereas major depressive disorder lacks in that area. So the clinical evidence shows both bipolar depression is more severe and involves more frequent depressive episodes and has a higher likelihood of a psychotic feature compared to what a major depressive disorder may do. Family history and treatment responses also vary between these two disorders. As we dive into some of the treatment options, when looking at George's case, lithium was the first line of treatment. And lithium has been discovered since 1949 and has since been recognized for its effectiveness in managing the manic episodes as well as preventing some relapse. Despite the benefits of lithium, it does require careful monitoring due to side effects such as tremors, nausea, and kidney concerns. So with George, unfortunately, he was inconsistent in taking his medication, which also contributed to worsening the symptoms presented within bipolar. Other treatments for bipolar disorder include anticonvulsant drugs such as carbamazepine and valproic acid. These medications help stabilize mood when lithium alone may not be effective for certain clients. Additionally, atypical antipsychotics and lamotrigine are used for different aspects of bipolar treatment, including managing depressive episodes and even acute mania. When truly digging deep into understanding bipolar, a lot of times we are not thinking about how much a mood disorder can really change someone's life and also bring great challenges. One of the biggest challenges for individuals with bipolar disorder is medication adherence. Many struggle with taking mood stabilizers on a consistent basis, which often is due to a reluctance to lose hypomanic episodes, which can feel energizing and productive. It's the norm for them, and it feels actually good, even though it may not be good. Research has shown that adjunctive therapy significantly improves medication adherence, which ends up lowering hospitalization rates and enhances overall social functioning for this population. Another big challenge for those facing bipolar is the impact on relationships. It can have a devastating effect on relationships, particularly during manic episodes where poor judgment, impulsivity, things can be said and done, leading to decisions that strain family and spousal relationships. Partners may struggle to distinguish symptoms from being intentional behavior, making support very important, as well as education to understand the disorder while also trying to manage it within families. Bipolar and depressive disorders are classified separately due to the fundamental differences within the symptoms as well as treatment needs. Bipolar disorder includes episodes of mania or hypomania, as discussed earlier, whereas depressive disorders consist only of depressive episodes. So, future classifications may explore bipolar's coexistence with other conditions to refine diagnostic approaches and also refine some treatment options as well. Individuals with bipolar disorder may also be more drawn to stressful jobs or activities to the nature of manic episodes, which include like exaggerated optimism, grandiosity, poor judgment. These factors actually lead them to underestimate stress levels or believe they can handle intense environments better than they actually can. In summary, and speaking of George Lawler's case, he was diagnosed with bipolar II disorder based on his history of manic and depressive episodes, as well as his family history. His treatment with lithium and psychotherapy helped stabilize his condition. However, inconsistent medication use contributed to severe consequences, including his divorce. In closing thoughts, this case highlights the importance of early diagnosis, consistent treatment, and medication adherence in managing bipolar disorder. With proper care, individuals can live stable and fulfilling lives. We thank you for your time today. We hope you had learned a little bit more about this complex disorder. And if you have any questions, please reach out. Thank you.